Hello, my name's Kim. I'm a midwife and midwifery lecturer here at Monash University, Nursing and Midwifery. We would like to take this opportunity to invite you on the journey of Victoria's labour and birth, both from the commencement of her contractions through the journey to the birth of her newborn baby within the birthing simulation environment that we have here at Monash University.
Today I want to show you our favourite simulator at Monash Midwifery. This is Victoria. She's very cool. She actually will give birth to a baby. So we turn a button on, she goes through contractions, and then the baby will actually be birthed. So you'll go through the crowning and then the catching of the baby. So it's really cool in that you can experience the whole act of giving birth without actually having gone on placement yet. And that often helps when you do get on placement, that you've at least had a hands-on experience. And that's something that we like to prepare you with here at Monash. So what we're going to do is assume a position that is semi-recumbent. So in this situation, that means that she's sitting upright a little bit. In reality, a woman may be giving birth in any position, but we practice this one first.
Ideally, the position for a woman in labour is the one that she chooses, and also one that supports her in an upright position and enables gravity to help her with the process of the birth of her baby.
So when we're ready, what we'll do is get Victoria switched on. As you can see, she's already breathing and blinking, so she's got some cool features there. So what I want you to do is glove up, get ready to go. We never know when she might actually get that baby to the perineum, and then have a good visual of what's going on here. In real life, you'll hear women begin to say that they're experiencing pressure that they need to push.
So many people think that a woman's in labour because her waters are broken, and sometimes that is the case, but not always. So whilst your caregiver will want to hear from you, it doesn't necessarily mean that you're in labour. The other more important things that tell us that you're in labour is that you start to get pains, or what we call contractions. These might start low down in your tummy, or up high in your tummy, or in your back, or down your legs.
Now that you see the head crowning, is just place a little bit of pressure on the baby's head. That's exactly right. And then with the next contraction, that head's slowly going to emerge. So I just want you to keep your hands close around the head as it's coming through. That's perfect. Well done. And you would be talking this through with Victoria, so letting her know that you see her baby's head starting to come and that she's doing a really fantastic job. Usually at this point, women will feel quite intense pain, so it's really important that we maintain that connection with the woman at this stage.
So options of pain relief for women in labour is to be moving around and keep active and well supported with the people that are there. Midwives can also suggest some pharmacological measures if need should be.
And that's really normal that it takes a little while. So Victoria simulates those contractions, and in real life, what will happen is one contraction may birth the baby's head, and then with the next contraction, you'll often see the baby turn, which is called restitution, and then the shoulders will be born. So there we go, that's happening just now. Baby's restituting. And then as that baby's beginning to birth, just move your hands further down the baby's body so that you're holding the shoulders in together. That can help avoid any injury of the perineum. Good, and then that whole baby should be birthed with this contraction. Perfect. And then we'll bring the baby up to be with mum and do some skin to skin. We encourage skin to skin, Hannah, for mothers and babies straight after birth, because that's what regulates the baby's temperature, its blood sugars and its breathing, very important for those reasons, but it also produces a hormone called oxytocin in both mother and baby that helps with bonding, with breastfeeding, and also pain management for both of them, because it has been quite a painful, stressful experience in the most part. So very important that we get that baby skin to skin. We also will tend to keep the cord intact, and that's so that the placenta that the baby is still attached to can continue to feed the baby with all of the blood and the nutrients that are left inside. Once the placenta's pumped all of that blood into the baby through the umbilical cord, then we can clamp it and cut it like you see in the movies. There's a lot of muscle memory in assisting a woman to give birth, and we say all the time that it's like riding a bike, you're not going to forget. So when we practice these skills over and over again, and then you get to utilise them in real life on clinical placement, you'll find that you've at least got that background muscle memory with you. So it should help with your confidence levels.
So I hope you've enjoyed this opportunity joining us at Monash University, hearing our birthing simulation, and I hope this inspires you to want to become a midwifery student and join us here at Monash University.